Well, welcome again. I'm Jason Renault with the Alternative Mobile Services Association. And today I'm going to talk to Therese Todd. And let me tell you a little bit. Therese is a Provostial Fellow at the New York University Law School. And she holds a Ph.D. in clinical psychology from CUNY Graduate Center through the John Jay College of Criminal Justice. She earned her M.Phil in psychology from CUNY and has a master's degree in forensic psychology from John Jay College. Her bachelor's degree is from University of California at Los Angeles, and during her PhD program, she was a fellow at the National Science Foundation Graduate Research in the National Science Foundation, and she was also a research fellow at the Vera Institute of Justice. So welcome, Therese. Welcome to AMSA
Thank
Talks.
you. So good to be here.
Let's start by you telling us a little bit about yourself and your areas of research now.
Yeah, sure. So thank you for the introduction. Right now, I am a faculty fellow at NYU in the School of Law with the Policing Project. And my research focuses on mental health inequities in the criminal justice system. And I'm particularly interested in how police and communities respond to behavioral health crises when they happen out in the community in someone's home, and how we can help resolve those instances as safely as possible for the folks in crisis and their families. And so I have, my research is really dedicated to this field of understanding police responses, understanding how we can use research and build an evidence base to help us learn about what helps alternative response programs or community safety response programs function most efficiently, effectively, and work toward achieving outcomes where folks are diverted away from the criminal justice system and are getting services that are helpful, and increasing access to care.
And that's the sort of the guiding principle is that people are being diverted away from the criminal justice system and maybe also away from hospitalization, unnecessary hospitalization.
Yeah, definitely. We know that people with serious mental illness are overrepresented in the criminal justice system, and that often even, treatment has been used for coercive means and to, gain control and limit people's rights. So we always, I think about these responses, how can we root them in humanistic approaches and while preserving people's dignity and, getting people support that they might be most able to access and utilize at the time.
So again, more principles there, dignity and humanity, acknowledging, recognizing those as the tip of the spear.
Yeah, I think so. And our society, our country has a long history of a bit of a dark history of how we have treated those with serious mental illness, from days of very intense and severe institutionalization to a movement away from that. And although, deinstitutionalization had good intentions, ultimately there wasn't the follow through that allowed for, people to be able to access healthcare or get their basic needs met in a way that, unfortunately, has resulted in some really negative outcomes in terms of, higher rates of homelessness, criminalization, and untreated mental health conditions.
And it's ironic that you're in the School of Law because it's the trying to manage mental illness using the law that's resulted in these sorts of
Mm,
institutions.
yeah, great point. Great point. And yeah, I love that. So as you mentioned, my PhD is in clinical as well as forensic psychology, and I approach this work both as a clinician and researcher. As a clinician, I have training in the treatment and prevention of psychosis, as well as evidence-based treatments for PTSD, and that's really where I've spent a lot of time about learning how to, with my clinician hat on, support folks. But that starts to my training and my PhD helped to really help me build this framework around how systems and laws, legislations have impacted people's lived experiences. And so now I am housed in a law school, and sometimes the same tools that have been used to cause harms are the same ones we need to, or not need, but can leverage, can use to help make them right.
Yeah, this is a big, gnarly problem that you just don't have in the world of psychology sufficient number of tools to wrap all the way around and really see the entire ecology and have the process of discernment that the law has.
Yeah, and right, there's like the individual perspective, and then which is often where psychology focuses on, although we also have like community psychology and um, diversity science, which incorporates all the other aspects of that ecosystem, and then bringing in, the law, though I'm not a lawyer, what are the implications for people's individual experiences in terms of the law and the impact there. But when you mentioned the ecosystem, it reminded me of this graphic where we think about a individual mental health crisis. And often an incident happens, and then there is all these steps taken on the back end, whether it is, and usually like very reactive. So whether the police are called or people are mandated treatment or involuntarily committed. And all of these services we tack on, um, focused on, okay, now something bad's happened. But what if we built out this ecosystem and it didn't start at the crisis, but we started to add to the front of it and made things more available and more equitable. So I think alternative response and mobile crises are part of that, and they're part of this really big ecosystem that I hope we can continue to expand.
Yeah, widening that perspective away from the apex, which is really what the local district attorney wants to look at exclusively, or the police reformers, and say,
Mhm.
there's a clinical history here which brought us to this point.
Mhm. Right. Yeah. So building, we are, I think we're all in this together to build out more opportunity and just create enhanced safety for folks.
It really is a golden moment, isn't it, of reviewing a lot of these civil practices. And we were talking earlier a little about your inspiration for getting here. How did you decide to make this your gnarly problem?
Ooh, good question. So when I started graduate school back in 2017, I was very interested in understanding how police respond to folks with mental illness. As I mentioned, these folks are overrepresented in the criminal justice system. They often have more negative or harmful interactions with the police, including higher rates of use of force. And there has been a long history of research and work in crisis intervention team training of police officers, where officers receive 40 hours of mental health training. And that's often, in a lot of cases, that some departments don't have any, but in a lot of cases, that might be all an officer gets. And although these are, important steps and initiatives, if that's the only option we have when responding to a crisis, we can see how that might not go so well, especially when you compare it to peers who have lived experiences of mental illness and have also their own training in how to resolve issues, and then clinicians who are required to have thousands of hours of training before they get a license, and while they're, having face-to-face interactions with people. So that was a long-winded way to say there's research on crisis intervention team training. It's not, the findings are not so strong, usually limited, mixed at best. And we know that a lot of harm is being done. So in 2020, we had the murder of George Floyd, in addition to several other very highly publicized incidents of people with mental illness or experiencing a behavioral health crises who were killed by the police. We had Daniel Prude Walter Wallace, and these instances have continued to go on. Sonia Massey and several in New York, where I am, and in your city as well that you recently told me about. So, how can we um, limit the opportunity for really horrific outcomes? And uh, that's what inspires my interest in this problem we have before us.
Well, it sounds like you have a lifetime of work ahead of you.
Unfortunately,
Yeah. Uh, tell us a little about your new project. You're going to map this universe.
I'm going to try. Yes, definitely. So, I sought out to do what's called a scoping review, or which is similar to a systematic review of alternative response programs. And in this project, I really wanted to look at this newer ecosystem of programs that have really started to uh, bloom post 2020. And these are alternative response programs or community safety response programs that do not include a police officer in responding to a behavioral health incident. So folks in the community might call 911 or another number in the moment of a crisis. And instead of getting a police officer on in their response, they could get a peer specialist, a mental health provider, and or an EMT. And these programs are really born out of that desire to limit the footprint of policing, to support police officers, and being able to focus on other really pressing issues and needs in their community. But to have people who are really focused and specialized on behavioral health being the ones to respond to those calls to help prevent uh, escalation. And so, we've talked a little bit about how we are defining the space, and it's definitely tricky. We have this big ecosystem of crisis response, and there are different models within that. Within mobile crisis, we're looking at just programs that don't involve police officers, and then I'm narrowing that a bit even more to programs that they're often 911 dispatched, although some use multiple numbers or another number, are housed in cities and are first responder programs. So they respond, I believe the criteria is within an hour of getting that call. That's the aspiration, but can really respond in the moment to a wide range of, social needs, whatever that might be.
Well, that's fantastic, and you have some assistance in this process as well. You're working with others.
Yes, so I'm right now building a team to work on this review because, as you can imagine, there's going to be a lot out there, but because this field is also so new, a lot of the sources will be on, will be government or local dashboards and reports, news articles, internal or external evaluations, and then a little bit of peer-reviewed literature. But there's going to be a wide range of sources we're going to have to scan. And right now, I'm planning to look at a specific set of programs that I mentioned that at this time I'll be using a directory of alternative crisis response programs, and seeking input from an advisory board that I'm forming at the moment to see, do we want to change that criteria? Do we want to expand it? Getting that iterative feedback from other practitioners, researchers, and experts in the field. And then working towards also making sure this is disseminated to the public as well in a way that can help people learn about these programs and how they operate and the tangible impact they can have on people's lives.
Well, yeah, one of the most exciting parts of this for me is the variety that we see of teams around the country. They're all headed in the same direction.
Right.
They're all trying to accomplish the same principled goals, but they're
Mhm.
getting there in so many different ways.
Yeah, that's a great point. And part of the my review hopes to understand how each program operates and really get an understand of their process, their operations, what their teams look like, and how that may differ based on the unique needs of the city or the community that they're serving.
Are you going to try to figure out what works best in any respect?
That is definitely the goal. And, with any research project, there are limitations and how strongly we can make claims about causality, of course. But I would really like to be able to connect these different process variables or operational variables to outcomes and to see, how different team composition, hours of operation, um, call-in type, a wide range of, a wide range of factors impact important outcomes um, in their services.
I imagine data becomes an important issue for you and how data is collected. And it
Mhm.
seems that everyone's collecting bits and pieces, but not none of them in the same way.
Yes, and I think we're going to run into that, and you know, when data is so discrepant, there will have to be decisions around how we're categorizing things.
Hmm.
And that's always a decision in research where cutoffs are or what classifies as, for disorders, mild, moderate, severe. And so I anticipate taking, the raw data we collect and then forming it into categories or groups and just trying to go about that in the best way possible. And then being very transparent about how those processes and decisions were done and made using open science practices.
And this is the magic of the PhD and the research tools that you've acquired is that you know which tools to use and when. I can't tell a spanner from a baseball bat.
I'm still learning myself. Yeah, these are tough questions, and I think that's really where I, want to and hope to pull on other people's expertise and how they've approached different questions, their knowledge of the field, both from the practitioner and research side.
Now, there has been some co collecting of researchers in this field. They're starting to meet and gossip and sort of hobnob together. That's kind of an interesting new experience here.
Yeah, yeah. So I've had the great opportunity to be invited into learning communities where researchers from across the country are talking about these issues and how to answer questions, what directions to go. And I love the community, and I'm continuously impressed by all of the work being done that I know about and don't even know about. But yeah, I think we will only thrive in coming together to help answer these problems.
Yeah, it is that golden moment right now where people are willing to share information openly and freely. And I agree. I
Mhm.
haven't met, I've been talking to people for 4 or 5 years now. I haven't met anybody who I don't like. Yeah, that's a great person. It's interesting. There's a
Yeah,
filtering of,
yeah, I think
these are
so.
nice people.
Yes, and super small worlds. Like I feel like I've interacted with folks where we've been at the same organization, or we know we have a mutual colleague or connection, and it's just, yeah, super small world that I it's nice to start to see these familiar faces.
Now, I'm always interested in how y'all researchers get your information to the street level and get it into the hands of the practitioners. Walk me through the steps
Yeah.
there of what would be your ambition for this research?
Yeah, and that's the magic, right? I am really motivated and interested in applied research. And so, on one side, doing like academic and peer-reviewed publications, that's really important, but also making sure with work like this, programs like this that are built by and made for communities, that that information is getting shared back out. So I think with every project it differs. Um, a big part of this project that is awesome is that it's within the policing project. They have infrastructure and folks built in who, are professionals in communications, policy. We have, the team you asked about. I'm the researcher, but there's a policy advisor who I think you've spoken with, and people who are interfacing in different ways with different practitioners. Um, and another project I'm doing is a community engaged survey, looking at, you know, um, community safety perceptions in a specific community. And that project, I built a community advisory board. Community members were the ones going out into the field collecting data. And we will work with our community advisory board to develop a community dissemination plan for those results so that it's not just this random researcher came in, asked a bunch of questions, and we never heard what happened with it, but to get the results back out into the community and hopefully to the people who did the work and answered the survey so that they can also use that information to serve their needs.
And this has a policy angle too for local governments and big nonprofits that are perhaps have a mobile crisis team alternative response on the drawing board to say, who else out there should I be talking to? It doesn't make any sense for, I don't know, a small town in Utah to be talking to Chicago. Who is that? Are you going to be able to help those folks who are trying to figure out who to talk to?
Yeah, so we're surveying all of the programs that we know of and collecting it, it will the city or town will be indicated, but also indicators of geographic region or the type of their type of service area. So that would definitely be included. And I do hope that this can help inform other programs. And that is the beauty of research, that we can start to build an evidence base or demonstrate how programs are run so that the field can continue to scale and sustain.
Maybe that's a special interest group AMSA should organize, is the city councilors thinking about doing a mobile crisis team.
Yeah, definitely. And I know, a lot of toolkits have been made and created to help cities learn about how to stand up um, different programs. Dignity Best Practices just put out their toolkit for the mediation response units to help with just that. If a city would like to do that, here are the resources that would be helpful and needed.
Yeah, the variety is continuously astounding.
Definitely.
Well, how can AMSA members help your project?
That is a great question. So, well, one, we're, as I mentioned, the advisory board component. We're looking for folks to participate in the advisory board. I'm also looking for programs to be in touch with, to be able to collaborate with, and hopefully learn from. So that might look a couple of different ways, but I think the first most immediate way would be we're planning to disseminate a survey to after we do or the review or while we're doing the review and learning from it to identify where the gaps are in the data that's out there so that we can go to programs and start asking about it, start learning, is this data you're collecting? If so, are you able to share the answers to these questions about how your program works or what outcomes might look like? So we're looking for programs who are open and receptive to being involved in that research.
Well, I wish you the best of luck. We'll have your information in the chat below in the show notes. And congratulations on getting this started. It sounds very ambitious, but I'm looking forward to learning
Definitely.
what you learn.
Thank you. Looking forward to sharing it with you. And thanks for talking today.